I am so excited to announce my newest baby, a book for parents all about tongue tie. Tongue Tie for Parents is the book you need if you have any questions about whether there's a tongue tie, how to get treatment, if your baby needs treatment, how to go about it, how to make decisions, how to help you and your baby recover. All of that is in this ebook. Every day I get questions from parents like you, and I know you need answers. Tongue Tie for Parents is built from the same step-by-step protocol I use when families sit across from me in my office. It's the information that you need for clarity, for confidence, and to help you make care decisions based on your own goals, because that's what's most important. You shouldn't need a Google search to get answers. You aren't crazy or overreacting. You are trying to figure out what is best for you and your baby. It's here and ready for you. Tongue Tie for Parents is an easy download. You can have it today for only $27. Go to tonguetieexperts.net/parentbook or follow the link in the show notes, because you and your baby deserve clarity, not confusion. Welcome to the season marking 4 years of the Tongue Tie Experts podcast. I'm incredibly grateful for what this space has become. What started as a simple idea to create thoughtful, evidence-based, and multidisciplinary conversations about tongue tie, infant feeding, and airway-centered care has grown into a global community of professionals who are committed to doing better for babies and families. Over the years, I've had the honor of sitting down with parents, lactation consultants, dentists, birth and medical professionals, therapists, researchers, and educators from around the world. Together, we've explored the science, the controversy, the clinical nuance, and the very real human stories that live at the heart of this work. My hope has always been that this podcast supports you in thinking critically, collaborating confidently, caring more deeply, and helping more people. If you're new here, welcome. I'm so grateful that you found us. To those of you who have been listening, sharing episodes, and sending messages over the years, thank you. Your support is the reason this podcast continues to grow. To our guests and sponsors, special thanks to you for your incredible contribution to this mission. Let's see how long we can keep this going. Please click, follow, leave a rating or review, and share with a colleague. It truly helps this podcast reach more who need to hear these insights. Now, let's get into today's episode. Hi, everyone, and welcome back to the Tongue Tie Experts podcast. I'm your host, Lisa Palladino. Today, I'm joined by Patty Reiger, registered dental hygienist and orofacial myofunctional therapist. Patty has over 30 years of experience in the dental field, including 13 years as a dental assistant and 18 years as a hygienist, and she brings a really grounded, functional perspective to oral health and airway development. In the past few years, she's expanded her work into myofunctional therapy, integrating it into patient care and education, and she now works with Remplenish, supporting both families and professionals in using tools that promote optimal oral function. What makes this conversation especially meaningful and honestly really special to me is how Patty and I connected. While she doesn't work with infants in her professional role, her granddaughter was born with a tongue tie. Like so many families, she found herself learning about this world in a very personal, real-time way. That experience gave her a whole new perspective on what families go through, and it's ultimately what brought us together. I'm very excited to share this conversation with you all. Welcome, Patty, and thank you so much for being here today.
Hey, Lisa, thank you so much. I was so pleased when you mentioned that I could have the possibility of being on the podcast because I talk about you a lot to my patients, customers, people who are looking for, uh, a specialist like yourself. And I just wanted to add in there too, how we originally met was back in September when we were in Salt Lake City at IAOM and we were out to dinner together. And we just were at opposite ends of the tables and just didn't get a chance to chat until we were shopping later on. And then I remember I asked you to look at a video of my new granddaughter because she would have been barely a month old, of her trying to use a pacifier. And as soon as you said, "Oh no, I see the lip curling, I see this and that," I was like, "Can I have your card? Because I have this feeling I'm going to be needing you."
Let's back up a little bit. How many people go to conferences and wind up doing a last minute shopping spree in Macy's? I mean, was that a fun night? We just got to throw that in there.
Fun.
And there were quite a few of us. So anybody who's listening who was with us in Macy's that night,
yes,
wasn't it fun? It was a different experience. You never know what's going to happen in the evenings after a conference. Some people go out drinking and others go shopping.
Yes. And I saved money because I didn't purchase anything.
Yeah, neither did I, but
yes,
we had a
ball. Did. Yeah.
So, and the other thing that, as I'm reading your bio and reflecting on your career, we're both older women. Let's just put it that way. And we're both older, experienced women who have made pivots in our careers with ever expanding knowledge and possibilities. So I applaud you for being one of those people that doesn't stay stuck in that original plan and keeps learning and growing. So thank you for doing that, because I'm sure there are people who have benefited because of that. So that's kind of amazing.
Yeah, no, and to your point, so actually probably it was over 15 years ago at a lecture, I heard about myofunctional therapy. And I remember them saying in there that breastfeeding was the best thing you could ever do for your babies. And I remember thinking, oh, I checked that box. I did that for both of my girls. But at that point, my girls were still at home and there wasn't as much access to taking courses on the internet. But I remember saying to my husband, I really would love to learn about myofunctional therapy, but it wasn't in my wheelhouse at the time. So I just kind of forgot about it and then got reintroduced to it. It was a little over 3 years at another lecture. And I do remember, I'm trying to think of what her name was, but she talked about tethered oral tissues. And when I saw, she had a video of Dr. Zaghi doing a tongue tie release. And then when the patient was asked what they noticed was a difference, if they had an aha moment, and she said that her neck and shoulder tension was released, I couldn't, I couldn't unhear that. I couldn't unsee it. I went home and said to my husband, now I have to know, and I have to find out about what this means, how this is all related. And then that was how I found MyoMentor. And that was when I ended up taking the course, so 3 years ago. And so it has just been a journey. And again, I kind of struggled with imposter syndrome because I'm like, here I am in my later 50s. And can I really do this? Is this something that my brain can handle, postmenopausal? And I was like, wow, now my brain was clearer than ever because I don't have all those worries of raising children.
If I could catch babies in my 40s, you can help people with exercises in their mouth in their 50s.
Yes, 100%.
Because I too, I went back later in life. I became a midwife. Just like you're saying, you get that little hint of something that niggles at you until you do it. That's how it was for me with midwifery. And lactation was sort of like that just sort of happened to me. But I've told that story a few times. I won't bore my audience with repeating it over and over again. But that niggling of there's something else I have to learn to do. That was midwifery for me. I always knew that I was always attracted to that sounds weird. I was always attracted to the field of
Yeah.
helping women have babies, and pregnancy, just, even beyond my own pregnancy, which I didn't really love that much. Pregnancy always, it was something I always wanted to be a part of and learn more about, and help women in a more natural way. So similarly with the way you learned about other options in your own career. So, if you're a young professional, or even not so young professional, and you're hearing that niggling in your heart about something that you're forced to do, follow your heart. Go for it. It's worth it. And you never know where it's going to bring you.
Yep.
Right?
Did I ever think it was going to bring me here with Remplenish, meeting you? And that was because of me working for Remplenish that we met at the conference, and Jennifer
Right. We
Rooney,
both had
and
tables. Yeah.
so
Yeah. So cool.
that was great.
A lot of connections, but we hadn't really ever met. But I knew your name too from the company before I met you. But then putting it all together and knowing we don't really live that far from each other, so that's pretty cool.
Yeah.
Too. So the other thing that's really, really cool is we're both in our grandparents' era, as the young kids say these days. And how amazing is that?
Oh, yeah. I mean, and I remember my own mother saying, you don't know what you're missing until you have your first grandchild. So I didn't know what I was missing. And I think everybody can resonate with that. And just being a part of that journey, and my daughter and son-in-law wanting all of us to be included in the birth process, and I didn't want to be right, but I did. When she was pregnant, I did hear some hiccuping that the baby was doing. She would say, "Oh, the baby's hiccuping," and of course I didn't hear it. I saw it, and saw her belly move. So that kind of made me wonder. I don't know much about the growth and development of the babies, but I wonder if there's some sort of a dysfunctional swallow. And then when she was born, she breastfed. She was able to do that, and then finally, and this is getting to our journey, Lisa, how we got together was. I kind of saw that she was breastfeeding well, but I didn't know anything about it. But I was hearing a lot of gas that the baby was passing, and the discomfort that came with that. And finally, my daughter asked for my help. And she said, I don't really know what else to do, because she was told when the baby was born, she had a mild tongue tie. And so I said to her, I honestly don't know much about babies, but I did hear on a lecture that's like saying someone is mildly pregnant. So either you have it or you don't, and then it has to be assessed, right, with function.
Right.
So that was what led to you. And I tell you, Lisa, she has mentioned multiple times how she felt heard and understood and validated just by our consultation, our first consultation. She felt like she had a plan, and then your skillful direction on how to find a provider, even the body worker, to help with the baby, and even to help with my daughter. And even for me, I mean, I felt like it was our journey, even though it was theirs, but I was there as a support. So it was very emotional. So that's why I was super excited to be part of this podcast, to talk about how it really is, like you talk about in your podcast, it's a multidisciplinary approach to care for the dyad and the triad and everybody that's involved.
Have you ever found yourself thinking, do I actually know enough about tongue tie to assess this baby, to talk to this family, to know what should happen next? If you've ever had these thoughts, our newest program, The Confident IBCLC, was created with you in mind. And it's open to anyone who works with babies and families. You don't have to be an IBCLC. This is a 1-hour live, low-cost, high-impact training for anyone working with babies and families who wants more clarity, stronger clinical reasoning, and more confidence around tongue tie and feeding concerns. This masterclass is here to quiet that imposter syndrome that's been whispering in your ear, and to remind you that you are capable, qualified, and needed. You can sign up right now at tonguetieexperts.net. The direct link will be in the show notes. Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. It's a family thing, right? Depending on how family is defined. For some people that, I've taken care of families that the family is a single mom and the caregiver, whoever that may be, whether it be a babysitter or a nanny or a grandparent. And sometimes it's a mom and dad, and sometimes it's a grandmother. I just did a consult this week too, and the grandmother was in the background at first, and it was, and she was just throwing in like little comments here and there, and I was like, "Come sit down with us," and we wound up having a beautiful conversation. But getting back to what your daughter faced, it's vital for us to say this over and over and over again. Families get dismissed and their feelings get disregarded, and I'm over it. Like, women have to stand up and say, this is my baby. I feel like something's not right. If you can't tell me, Mr. Doctor or Miss Doctor, what's wrong with my baby, can you please send me to someone who can, So I'm sorry that she didn't get answers right away. And I hear this story on a daily basis, and it frustrates me. It's what pushes me and helps me to be motivated to continue this work, because when I think I've reached a lot of people, I realize there's so many more people to reach with this message. And then let's go back to, you're a myofunctional therapist, and by definition, a myofunctional therapist does not take care of babies. And this is a point of contention in the fields. And I always like to recognize, I like to say, I'm friends with everyone. Right. I will be your friend no matter what school you're in, because I'm friends with everyone, and that's how we learn. But there is a distinction between what you've learned in your myo courses and what I know how to do with a dyad, right, mother, baby, newborn, right? So it's important to state that because I don't want anybody to get upset and saying, misconstruing us saying right, that a myofunctional therapist can take care of a baby. You actually realized you couldn't, right, which is why I respect you, because I have seen certain therapists try to guide their own children or grandchildren thinking they know, not realizing what they don't know.
Yeah.
And not good results happen. Right. So
that is the one thing I have always been transparent. It's like, I know what I know, but I clearly know what I don't know, and I'm not going to pretend, because it hurts people.
Same. And that's what makes us successful. And I think the confidence in our own self, and maybe the fact that we aren't 20-somethings, gives us a little bit more confidence in that, knowing that, and being okay with not knowing everything.
Right.
Because I feel like the older I get, the more I realize what I don't know.
Same here.
More than what I do know.
Exactly.
And my kids will attest to that. They're like, you know nothing, Mom. No.
Well, and to your point, when I first finished the Myomental course, and then I was looking for providers in my area, I found Dr. Howard Hendon was only a half hour away from
Mm-hmm.
me, and I found him through the Breathe Institute um, directory, and I was like, oh my goodness! So I reached out to him, and I just told him I was a new therapist, and so he warmly embraced me and became like a mentor to me. And I remembered in our first meeting, I said to him, I'm in a rabbit hole with myofunctional
Mm-hmm.
therapy. And he said, actually, have you ever seen a rabbit hole? And I was like, well, not really. He goes, they're called warrens. And so, and I have this on one of the slide decks that I use for a presentation. I found online a picture of a rabbit going down a hole, and there's multiple tunnels. And he's like,
Yes.
that's what you're
Yes.
in. He goes, you're going to find you go down
Yeah.
one hole, there's a tunnel. And I didn't quite get what he meant then, but I get it now because it goes into infant feeding, it goes into airway, not just tethered oral tissues, palate expansion. I mean, there's just body work and fascia. There's just so many rabbit holes that we could get into. And so that's what I found very overwhelming. And so I feel like just approaching it in piecemeal and meeting other providers, like the interdisciplinary approach, has really helped me understand that the more I know, the more I don't know, but I know where I need to prioritize to continue learning.
Yeah. And also, that brings up the point of knowing who to refer who
Yes.
to, and having an excellent referral system, which is part of what I teach in my courses, all about how to find your
Mm-hmm.
team, because we can't, any one of us cannot do all of
Mm-mm.
this, right? And anyone who claims to be the one who does it all, something's wrong there, because you can't, and I defer to my speech language pathologist friends a lot for cases. I'll recognize tension in a baby. Like, as you remember, when I saw your granddaughter, I didn't say she needs this for that. I said she needs to be
Mm-hmm.
evaluated by, and I gave different choices of different types of providers, because I'm not the expert in body work, even though at this point I probably instinctually and because of experience know what type of body work would work best for each baby. But it's not up to me. It's up to the parent, and it's up to me to say, this is what I think needs to be assessed, not this, I'm not going to say your baby has torticollis or your baby has plagiocephaly or your baby has fascial tension. I'll just say I'm feeling something that makes me think that, kind of thing, because I have to stay in my lane. I want to stay friends with everyone. I want the baby to get the proper evaluation, not my, whatever, off the cuff, not, I don't want to say not educated, but you know
Yeah.
what I mean. I don't want to, like, excuse my French, half-ass it for this family. I want to
Yeah.
give them a full optional choice of different providers. And when someone's local to me, and even sometimes when they're not, I know people that I can refer to. So
Yeah.
that's cool. And
And that was what was helpful with
for
us.
those listening who are skeptical, we don't get kickbacks for those referrals.
That is true. Yes, I didn't think about that. Yeah.
Yes.
And yeah, and even
Yeah.
like
Yeah.
the dentist that you linked us to in Connecticut, Dr. Julie Harris, she was just
Hmm.
so amazing and just so comforting that even through email, she allowed me
Hmm.
to ask her my questions. And I was quite transparent, saying, I am not a doctor. I don't know anything about this with babies, but can I ask you some specific
Hmm.
questions? And she just had
Hmm.
sent back a beautiful email answering in detail all of my questions.
Beautiful. Yeah. Yeah. And we had contact too. So that's how the team works. She messaged me, said, thank you for the recommendation. I told her about what I found. She told me what she found. And then together with her and your daughter, you made treatment decisions. So yeah, that's how it should work. It's in the ideal world is how it works. And baby and mama are having improvements, which is, that's the result that we want. Not that we're all friends and,
Right.
whatever. That's wonderful. But the bottom line is the protocols that I have developed to get through these steps and to know what to do when, that is successful. It leads to successful outcomes. It's not all the same treatment, but if you follow the guide of the protocols, you'll have better outcomes than just, randomly deciding what you're going to do next.
Oh, yeah. Yeah.
And she is doing better,
She,
right? We haven't talked in a couple of
yeah,
weeks.
yeah, she is. And to your point, in one of your recent podcasts where I think you had mentioned, this is where a lot of people kind of make the mistake that they feel like it failed because they didn't see 100% improvement, or they may have seen, very little improvement. But there's always follow-up care, and that the tongue tie, or in her case, it was a pretty significant lip tie, tongue tie, and cheek ties that were released. That might not be the end of the course, that there has to be continuing support. So I think a lot of people don't realize that that's not the end all.
Right. And the follow-up is important to catch if there's a little bit of slippage backwards in function, to catch it and improve it before it becomes untenable. I mean, I have, my daughter is very willing to let me discuss her children, and my granddaughter, who I haven't done an episode on my granddaughter, and I'm like really looking forward to having my daughter on and letting her tell her own story. But my granddaughter had a release early on. She had all the best, all great care, all my friends and my teammates and whatever, and we did the right thing all the way through. And then because life gets complicated, my daughter didn't follow up except with me. If something's going wrong, Mom, this hurts, or that's going on, or whatever. And I kept saying she needs to go back to the osteopath. And she just, yeah. We just like symptoms, Band-Aid treatments to what was going on. And I spoke to this SLP who took care of her, and she's like, she's got to get back with the Myomunchie. We couldn't find the Myomunchie. It was like a whole thing, right? And then last week, she finally got her back to the osteopath. And now this is after months. And she said, Mom, with the first feeding after her treatment, there was no more pain.
Oh, my.
So it wasn't, if you would have looked in her mouth, you might have said, oh, it looks like it reattached. There's no reattachment there, right? So you say, well, Mom's gotten pain again. Right. She's getting multiple clogged ducts, and it looks like there's a frenum there. It must be reattachment. It was not reattachment. She just needed an adjustment in her whole, she was a little bit tenser on one side than the other, and which made sense with the nursing. So, and constipation, which resolved immediately.
Wow.
So there's different treatments that work at different times. And that's why I love that you brought up that follow-up and keeping going and the improvements.
Yeah.
The other thing is that your granddaughter was a little bit older when she started treatment. And it's often a challenge, or more of a challenge, to get improvement on an older baby who has already been compensating for a few months.
Yes.
So it takes longer to get those improvements.
Right. And it was interesting because when you said that on the last consult, after we were done, Rachel and I both said, I didn't consider that it was that old, because I think she was 5 months when she had it done. So, but you're talking as opposed to being newborn. Old. Yes. Yeah. And it would have been, but the wheels weren't set for that direction yet. So, but better that than 2 years old,
Oh yeah, I'm not saying it shouldn't have been done, but to give your daughter and the baby some grace in the progress, and not expect it to be an overnight, because she didn't get there.
That's right, 100%.
She and credit to the babies who work so hard to thrive under not ideal circumstances. Isn't that cool?
Yes.
And then there's those of us that are older who we didn't thrive. I didn't even get the chance to breastfeed. My mom never put me to breast. It was nothing she even conceived of doing. And all the consequences that have happened because I never was breastfed, so whatever. It's all very interesting. And I love the intergenerational approach to this, because we are the village for our daughters, and especially daughters. Like I have, not to insult my daughter-in-law who just had a baby and is doing amazing, and I'm so involved with her life and my new granddaughter's life, and I appreciate her so much. But there is something about your daughter having a
Hmm.
daughter that is it's just special. It's just like really, really
It
special.
is. It is. Yeah.
Anyway, anyway. So Patty, so now you have a clinical practice at the current time, or you only working for Replenish? Like tell me about your life
Yeah.
now.
So when I finished MyoMentor, I was still doing clinical hygiene, and I actually was doing clinical hygiene up
Mhm.
until about 2 weeks ago. And so trying to
Mm,
integrate that into the practice became more of a challenge just because of some of the New
mhm.
York stipulations and how we could go about finding our patients. And it just kind of limited my approach to being able to practice myofunctional therapy the way I wanted to. So that was what kind of made me think outside the wheelhouse of how can I use my myofunctional therapy knowledge and to continue to grow with it in a different setting. And I had this aha moment about a year and a half ago. Hey, I learned about Remplenish about 3 years ago through a study club, and they interviewed Anders, our CEO. And when I loved the product and the science behind it, I ordered it. And then it took me a while to realize that I am really doing a lot of advertising and recommendation for them. So I had that epiphany. Let me just reach out to them to see if they could use in because they're based in Minnesota and I'm here in New York. I was thinking
Mhm.
like for sales, maybe I could just find practices in our area that don't know about Remplenish and start to like promote and teach. Kind of like in the dental setting, we talk about a like a water pick model. Like we have different hygienists who
Right,
come to the different practices and do like a lunch and learn and really show the
right.
value. We know the efficacy, but how do we explain it? How do we teach the staff to explain it to the patients, right? So that they would see
Mhm.
the benefits of using it. So I sent an email out and they responded. They were like, we've been thinking about getting somebody who's a dental hygienist and who's a myofunctional therapist. So I just started out with them while I was still doing hygiene in my clinical practice, and then treating like family and friends for myofunctional therapy on my own time. And then it just kind of evolved into where I'm working with them as a consultant and a specialist. That's what my official title is. So, for instance, if you purchase like our product and you're unsure how to use it, even though we have some videos and we have FAQs on our website, a lot of people still struggle to know if they're doing it right, or they think it's not working
Right.
because they don't notice anything. So that's where they found out that having somebody like me who is a dental hygienist and a myofunctional therapist could do Zoom consultations. So that's what I do. So I'll get on
Mhm.
Zoom. I have my calendar link. They are given that and they set up a time and we do a call just like this and we go over like if they want to share why they made the purchase and I like to review them using it and 99.9% of the times they were not using it correctly and not getting the full benefit. And if they still can't get it, which is very, very unusual, um, it could be, and this is where we stay in our lane. I don't make any diagnosis, but I have an email that I send out after the call to give them referrals to different organizations for myofunctional therapists or identifying what is myofunctional therapy. How do I know if I have this disorder? And good reading material and good instructional videos and things like that. So it becomes like a little
Mhm.
coaching session. And that
Mhm.
like on a daily basis when I get to see and talk to people, it's like I've given them a direction on how to dig deeper. Because I don't know, we talked about earlier, you saw the Shark Tank episode that we were featured on last week, which was super exciting. Um,
Yeah, how exciting
yeah,
for the
and
company.
Anders made a a comment in there when he was asked, well, how did your company grow so exponentially? And he talked about through Meta and social media. Well, he wasn't exaggerating. A lot of people are finding us
Mhm.
through that because Meta knows what you're looking for or what you're sort of thinking about, right? And so a lot of people will make a purchase of this because they're trying to figure out how can I functionally get to my root cause of why am I snoring, right? If somebody's not
Mm-hmm.
overweight, they don't have a big, wide girth of a neck or anything like that, they could just like, what else could I do? So that's where the nozzle has
Mm-hmm.
been very helpful. But if they're not really sure
Mm-hmm.
if they're using it right, or that they may need extra support, like seeing an airway focused dentist or airway focused ENT or myofunctional therapist or speech therapist, I have all of these references for them so that they can make their own decisions.
So that's great. It's like you're the entry level for a lot of
Mm-hmm.
people into this whole field of figuring out their own airway situation, which, you know, isn't it kind of sad that we have to turn to social media? I mean,
Mm-hmm.
I'm glad that your company is doing well and people are getting help. I'm not
No,
saying
I
that,
know.
but again, the same thing like I was saying about the young moms bringing their babies and getting no answer. The same thing happens with grown-ups, I am sure. Like why I remember years ago telling my dentist that I had TMJ and asking him, I said, "Isn't there specialists for that?" And he was like, "Oh, it's a lot of nothing. They're just trying to make money." Like I knew nothing about what I know
Right.
now. This is probably I think I was in my early
Mm,
20s, and I was already clenching and grinding and having pain in my jaw. And when I think back to that, if I could have gotten help then, things might have been a lot better all
mm-hmm.
along my lifespan. But whatever. You do what you can. But so the fact that people are facing no answers or medical professionals not even recognizing that they have a
Mm-hmm.
problem and they have to turn to social media to find what could be there, or Meta's got to read their mind and send
Mm-hmm.
them,
Yeah,
if they ever Googled airway problem, when the ads come out, it's going to
that's
come
right.
up or in the natural algorithm, right? So yeah, it bothers me that anyway. What I'm going to say about this is when people say yes, we do have to stay in our lane, and I
Mm-hmm.
believe that. But when people are starting to complain about, this one shouldn't be doing this or that one shouldn't be teaching that, and I get people making comments that I teach about breastfeeding and tongue tie to people who aren't lactation consultants. There's enough problems and enough people and enough babies and mamas and enough grown-ups with sleep apnea for us all to help
Eh,
somebody. And then still they're all not going to get
yep.
help.
Yep.
So let's do all the things we can. And with an excellent resource for further. You're not saying to them, well, if I can't help you with this straw, you're out of luck. No, you're giving them answers. And yeah, my own personal experience with Replenish is that it's difficult for me. It is a challenge. And I tried it for a bit. I gave
Okay.
up. Complete honesty. I was like, I have no head for this. This is too hard. I just want to drink my water.
Right.
And then I reapproached it again, and then the same thing kind of happened. And I'm going to try it again because it's worth it. Something shouldn't just be hard. And I did have a private
You did.
session
Okay.
with Jen. I think
Okay.
Jen, we got on once and did that because I wasn't doing it right. You know,
Right.
it's like if it's too easy, you're not doing it right. And if you can't get water, you got to do something
Yeah.
different.
Yeah.
So
No.
it's something, I'm just going to say for listeners, you'll be hearing more about Replenish because they're going to sponsor our podcast. And I'm grateful for that. They're going to do a little sponsorship for us, but it's really worth looking into because it's an interesting way to realize that there's a motion you haven't done with your tongue, like that
Right.
most of us who have trouble or any airway challenges aren't using our tongue in the proper way, and this exercises it to a point where you actually get sore, like you worked out,
Yes. Yeah. And I've even
yeah.
just recently had different, not only customers, but healthcare providers, when I'm doing a Zoom call with them on the proper use of it, they said, this seems like this is like breastfeeding. And I said, it is pumping. It's
Yeah.
your tongue is doing those push-ups like a baby is doing. And
Right.
so, and
Right.
that's why, and just a little quick, I'll show you, even though it's, you're not going to post this, but if you watch me, and we've just made videos for the company that will be shortly posted on the website that are going to be instructional videos of how to even know by looking at your face if you're doing this right. So one of the things I like to
Okay.
encourage is good posture, sitting up straight, because I've seen people do this and they just can't get the water flow. But doing this, the
Right.
brain and your bottle are going to connect. Your brain's going to be like, oh, I should lift up now because I'm using the bottle. So
Mm-hmm.
you put your lips right to the bulb here, and then you just do a very slow and controlled sip and swallow, and you'll see what the SLPs call an invisible swallow, very neutral face. So like this, Lisa.
Mm-hmm. Yeah, I can't even see it
Right. But
moving.
now,
You know, for those you.
if I don't go all the way down, Lisa, you'll see how different
Uh-huh.
my face looks.
Oh yeah,
Hmm.
yeah. So those listening to the podcast can't see the video, but what Patty is doing is using the replenish straw correctly and then incorrectly, and then we could see the difference in how her muscles are
Right.
activated in her
So
face.
coming soon, it will
So
be
cool.
on our website where it can be easily accessed, because
Yeah.
we realize that a lot of people, it's not just enough to be told how to do it. If they see it, and then parents and children, they can observe each other
Mhm.
like a child. Because I would hear with children, parents saying, "Is your tongue doing what? Is it this? Is it that?" And then we just simplified it to, if you see their faces relaxed, if you use it like a regular straw, it'll be a little bit more of a challenge and
Mhm.
everything will pucker. But if you go all the way down, and that's what a lot of people aren't really sure about because they're not used to putting, when you drink a regular straw, you're only getting to the tip of it. So I
Right.
think innately that's how people want to use it. So those videos will be very, very
Mhm.
helpful, and we're excited for it to be ready to be posted.
That's so cool. And this is for what age group of children do you start with?
Yeah, so 3 years old is what we recommend.
3 years
And I
old.
will qualify that with, I at a young age, if it was my daughter or grandchild, I wouldn't just give it to them and let them use it. You just, until it becomes their normal to use it correctly, you want to monitor them to make
Mhm.
sure that they're using the wrong muscles, because then they're not really getting the benefit of it, right? And they're developing
Right.
worse patterns perhaps, or they
Right.
just may want to chew it like a mile munchie, and it's
Right.
chewy, but so, or to
It's
send it
different.
to
Yeah.
preschool or to daycare or anything like that. I feel
Right.
like if you view it as like a therapy wellness tool, then it could be something that's kept at home, and it's like a nice little investment
Mhm.
in your child's future. And we've gotten some beautiful feedback from children. And in fact, I'm doing a research project, that this is the other benefit that I had of meeting when I was at Salt Lake City with you guys for IAOM. I met with Trisha O'Hare, and she has the O'Hare University for a bachelor's program. So in 3 weeks, I should be finished with my program. But I'm doing a research project on how Remplenish and the kazoo can help create an awareness of nasal breathing and good, strong tongue posture. A couple of things. But anyway, just one of my first
Right.
participants just said that his awareness of his tongue being up is like amazing. And so he noticed it
Yeah.
helped by breathing better. His anxiety was a little lower. He's learning how to manage it better and how to be more aware of nasal breathing, which is what the Remplenish will do, because you're using that. Clearly, you have your lips sealed, so you have to breathe through your nose, right? And then your tongue is doing those tongue push-ups. So you're getting a lot of good different engagement for that good neuroplasticity.
Right. So an important point that you made, and I just want to reiterate that, is this isn't something that you buy your kid and let them use this all day long as their sippy
Right.
cup. This is this is targeted therapy to be used under supervision, especially for the really young kids, because they could be, we don't know if there's any harm to doing it wrong, but we know it won't be
That's
beneficial
right.
for them to do it wrong. And if they're doing it right, they can't use it all
Right.
day. They just
Right.
couldn't use it right all day
Right.
long. But, that's my experience, because it's
It
work. It's
it is
definitely
work,
work.
and I tell people it's not considered a hydration tool. It helps
Mhm.
support hydration. And if you're at the gym and you just want to chug, this is not the nozzle.
Right,
When I take
right,
mine to the gym, or if I'm super thirsty, or if I want to take a handful of vitamins, I just get an open cup of water, right? And then
right.
just, my goal is to drink 1 to 2 bottles, which the bottle I have is 26 ounces throughout the day. So it's intermittent
Mhm.
therapy, exercise.
Right, right, right. Well, I'm excited to get my new one. I know it's on the way. I
I was
can't
hoping you would have
wait.
had it by today, but
Yeah. It might actually be outside my door as we speak, because I did get a shipping notification, but I will definitely post pictures with it when it comes. But Patty, I just want to say thank you so much for taking the time. I know this is a really busy time for you with all the exciting things going on with Remplenish and with your role in the company. And, pass my congratulations on to your entire team. The Shark Tank episode was really, really sweet. I really enjoyed it. And I don't watch network
Mhm.
TV, but I tuned in to watch it. And if any of my listeners, look for the episode with Remplenish on
Yeah, it
Shark
was
Tank.
episode.
And what date did it
So
air?
it aired on this. I want to say the 16th, but it's on
Okay,
Hulu. It's streaming on Hulu, and it was episode
okay.
14, and he was the first.
Episode
Yeah. So I was
Yeah.
at.
Yeah, it was a really cute skit. And yeah, it was like, it made me proud to know your company, because like, this is really cool. The exposure that airway and snoring and breathing is getting on national television was worth it in itself. So
Yeah,
yeah.
it's been quite a banner year for our company, and we in January,
Mm,
I think because I was asking if you were going, we went to Switzerland for that tongue
right.
tie conference, and that was an
Yeah.
amazing collaboration with a lot of practitioners from Europe and all over the world that had come from other continents. And
Yeah.
we really made some wonderful connections there. So between that and then Shark Tank, and then last fall we just rebranded. So the packaging that we had years ago is a lot sleeker and really, really cool looking.
Good. I'm excited. So thank you for being with me today, and good luck in all your endeavors. And I hope to catch up with you again
Thank you,
soon.
Lisa. We'll see you in Portland at ICAP.
Yes, yes. Everybody go to ICAP in Portland. That'll be just a couple of weeks after this episode airs. Oh my goodness, I'm losing my words. So I'll see you in
All right.
Portland.
Thank you, Lisa.
This podcast is meant for education and conversation only. It is not medical advice and does not replace formal education, professional training, or individualized care from a qualified healthcare provider. Always seek appropriate guidance for individual concerns. The views and opinions shared by our guests are their own and do not necessarily reflect those of the host or tongue tie experts.